Valley Talk on News Talk 1580 KGAL.
And a very good day. A little wet outside today, but it's what we call liquid sunshine in the state of Oregon. That's what makes things so bright and green. Hey, I'm Dave Adams. This is Valley Talk. Glad to have you with us today. It's 11:06 is the time. And we're going to have two sections on the show today. Also, by the way, let's tell you about what's going on in tomorrow's show. Tomorrow's show, we're going to have Tom Courtier in the studios with us. Also, Herring is going to be here as well. And Tom, of course, is pushing some initiative petitions against the city of Albany to limit their debt load and so on and so forth. Tom is going to be here. He has some things he wants to say, and Hasso and I are going to be visiting with him about his position and some of the things that he heard on a Valley Talk show that he has doesn't agree with. And so we're going to give him some equal time and allow him to come into the studio and talk to me about some of the things I said and about his position about these initiative measures. So that's coming up tomorrow on Valley Talk. Also, Legacy Ballet and Pops concert coming up in Salem. Will be a guest on our Valley Talk show tomorrow. So looking forward to it. Tune in tomorrow. Make sure you sign up today and tomorrow for Quiznos Taste on Us. You can just simply send me an email, dave@kgal.com, or call the radio station at 926-KGAL or 451-KGAL. And at the end of the show today, we are going to be drawing for $10 gift certificates from Quiznos. Today, we're going to be talking about healthcare. Last half of the show, last two-thirds of the show, we're going to be talking to Kelley Kaiser of local Samaritan Health Organization here, Samaritan Health Services, about what's going on in Oregon, what they see, what some of the challenges are. It's a broad-ranging topic, and we're going to take a stab at it today with Kelley Kaiser on Valley Talk. In the studio also today is John Gibson, our average investment guy. John, thank you for being with us on the program. I guess you got to leave here before too long.
Yeah.
So we're going to start with John Gibson today. John, what's going on? You came in this morning excited about talking about legal tax evasion.
Well, you know, I noticed last week there was, and Walmart is one of them, and I own Walmart stock in my portfolio, just to be clear. I started to notice that these companies were moving their dividend payments due in 2013 forward or backwards to 2012, paying the dividend that they would normally pay, like in January or February. In 2013, they're now going to pay it in 2012, December 2012.
Maybe that's not in the best interest of the stockholders. Can they say, no, we don't want to take it? Or
Well, it is in the best interest of the stockholders because I'm guaranteed paying 15% on my dividend as opposed to possibly I'm in the 28% bracket,
okay,
and then 4%.
Tax rate's better.
Yeah, 4% more for Obamacare. So, yeah, it affects me. And so your initial thinking is, well, that's kind of nice. But then when you dig into it and you look at someone like Oracle, Larry Ellison is the CEO of Oracle and the founder. He not only moved one dividend payment forward, he moved the dividend payment in 2013, second quarter, third quarter 2013, and fourth quarter 2013, all back to 2012. Now, he's going to save $60 million. This is what was reported on CNBC.
Okay.
Apparently going to save $60 million by doing that. My only issue with that is all I hear is what a mean, nasty guy I am because I'm an old white Republican who probably cheats on his taxes and I'm the bad guy. These are young white Democrats doing this. You would think that if they were all so happy about Obamacare and Obama's tax rates that they would be willing to pay their fair share. That's all I ever hear. Pay your fair share. These people are not. It's perfectly legal, but you're avoiding paying taxes by doing that. I always heard that was called tax evasion. Now, it's perfectly legal. You can do it. Just like, members of Congress can inside trade stocks. I mean, it's perfectly legal. It's unethical. It's not fair. But so I'm a little tired of being told that I'm not paying my fair, and I'm not in the top 2%, so I'm not in that category. But this is not Republicans doing this. This is Democrats avoiding taxes.
All right. So Opinions expressed by John Gibson, by the way, are those of John Gibson, not necessarily those of KGAL Radio, Eads Broadcasting, the host of this show, or anybody, advertisers associated with KGAL Radio. So
that's why I don't have any sponsors. I want to be free and clear to say whatever I want.
But one of the nice things that I like about radio and about this country is that you can go on the air and say whatever you want, and the government is the government isn't going to come in and turn off the transmitter.
Right. So, this is America. I mean, the bottom line is I love America. I'm not quite sure what we have right now, but I love my version of what America was, and I hope will be again someday.
Let's talk about this fiscal cliff. Everybody's talking about the fiscal cliff. We're going to fall off it. The average Joe listener or Jane listener on the street who's hearing, well, they seem to be upset about the fiscal cliff. Are we going to fall off it? What's it look like now, and what's the big deal?
Well, it all comes down to whether or not they're going to raise the tax rate on the top 2%. All right, that's the line in the sand. And Obama came out today, and that's why the market's down. And he said, I'm not partisan, I'm not political, it's just math. You know, we have to raise the tax rate. And, of course, the Republicans say no. If we fall off the cliff, the average family will pay over $2,000 more in taxes. Just because payroll taxes will go up, you'll have less take-home pay. My taxes will go up on dividends and capital gains and things like that. So the average family will see about a $2,000 hit.
Now, if you're a betting man, it's not, since we have the same players in the field, Obama and the Republican-controlled Senate.
The Republicans control the House of Representatives.
House of Representatives.
The Senate is controlled by the Democrats.
Players are the same. They have not been able to reach agreement up till this point. And it doesn't look like they're going to be able to do it now. Is that the common
that's what the market is starting to look at. That's why you're seeing the market starting to weaken. You also had some economic data that came out yesterday that was bad. Manufacturing declined. But the market is looking at another recession if we go off this, what they call the fiscal cliff. It's really not a cliff, it's a slope. And you can go after January 1st, you can go back in through Congress and retro fix things and give the middle class back their, Bush tax cut levels, It'll be a disruption. But on the market side of it, you're going to see selling. You're going to see people going, dang, these guys can't fix it. It's very simple. If they can't fix this issue, how are they going to fix Social Security and Medicare? And I'm sorry, it was ridiculous when Obama sent Tim Geithner to John Boehner's office. John Boehner is the leader of the House of Representatives.
Speaker of the House.
And one of the provisions was that they would repeal the Congress's ability to be fiscally responsible for the budget. Obama wanted no more debt limits. He just wanted to have a blank checkbook. Well, that's silly. I mean, how can you call that bargaining in good faith? I mean, that's Congress's only job is to regulate money, So I see it in Obama's best interest to keep this thing going for as long as possible, because we're no longer talking about the 4 dead Americans in Benghazi, the cover-up that Susan Rice did, the spilling of blood in Syria that has been, 4 months now? That civil war has been going on, and now Syria is moving their chemical weapon stash. And Obama did come out and threaten to use force if they did gas their people. We have Egypt falling apart and riots in the streets. As long as this news cycle continues, then none of those other issues get looked at, and he kind of gets a pass. So,
what about all this unrest in the Middle East? How's it affecting Wall Street?
Well, it's not affecting Wall Street yet. Wall Street is like a soap opera.
Okay.
It's a story that never ends. And so it's not time for it to be worried about Egypt and the Middle East yet. Right now it's worried about today's menu. Once today's menu, the budget crisis gets resolved, then we'll move on to foreign policy. And, unless something happens, if Iran fires off a missile into Israel, then that becomes the focus of the stock market. But the stock market is like, it just flits from one problem to another. You can go back in history, and we've had crises all along. My worst day in the market was 1987. And I've been in the market since then. So that's almost 30 years, I hate to say, or something like that. So it won't affect the market until blood falls, blood spills. And then that's when the market will notice it. Right now, it's all on focusing on the budget and is on the slowing down of the economy.
Christmas shopping so far looking good.
Well, I haven't seen any numbers lately. Black Friday, Cyber Monday, whatever it's called, those were record sales. What I'd personally do is I like to go to Walmart and just walk around and look at the parking lot, look at the people, look at the baskets, see how much is in there. And in doing that, I do see less traffic. Costco is a great place to go. Look at the baskets in Costco. If they're half full, that's not good. The ones that are heaping, you want to see that. That's where they make all their profit in these last couple of weeks of December.
So the jury is still out on that.
Jury's still out. Given that gas is down just a little bit, consumer confidence is up a little bit, manufacturing is down. That was a negative. But car sales were up. GM was up 3% year to date. Ford was up 6%, and Volkswagen was up 33% year over year in car sales.
Why is that? Did you look into that a little bit?
No, I think it's pent up demand. I think that early on in an economic crisis, people freeze. Nobody wants to spend any money. Well, then over time, your car gets old, or your washer gets old, and you just can't put it off anymore. And for some reason, it just kind of was a wave of buying. It was, remember Cash for Clunkers? That got a big wave of buying, and then car sales died. And now this is past the absorption of Cash for Clunkers.
Okay. Closing thoughts. So we've got a couple minutes yet.
I just think that if you have profits, I would pare down a little bit. I sold Pepsi the other day. I bought Pepsi in 1994, I believe it was. I felt like I got divorced, But I'm so afraid of taxation. My accountant can't tell me what my taxes will be. So I'm selling, and I'm depressed. I feel sad. This is not the America that I know.
Okay. John Gibson, average investment guy, with us every Tuesday here on the show. Again, we do want to put our disclaimer out there. Opinions expressed by John Gibson are those of his, not necessarily those of KGAL Radio, Valley Talk, the Valley Talk show host, which is myself, or Eads Broadcasting. But the cool thing about radio and the cool thing about press in America is we have the opportunity to express our opinions. That's what makes this a great country. That we don't necessarily agree one with another, but we definitely have a chance to share our views. And so
the bottom line for me is dollars. Right. I just want to make money. I know that's evil, but I report things based on how it affects my bottom line and everybody else's.
There you go. Hey, John, thank you for being with us today. Have a great day. See you next Tuesday, and Valley Talk will continue when we come back. We're going to be talking to Kelley Kaiser with Samaritan Health Services about healthcare, what's going on in Oregon, what's going on across the nation, changes that are happening, and how you can get involved. Valley Talk will continue in just a moment.
When you look out across the Willamette Valley, you'll see plenty of banking choices. Willamette Community Bank is here to give you an option that's pretty unique. Like no other, in fact, Willamette Community Bank provides an alternative to large national and regional banks by offering customized financial services and local decision-making to benefit local people, local families, and local businesses. How many banks can say that? Willamette Community Bank. Service like no other. We promise. Member FDIC.
The customs of Christmas. As a custom of Christmas, bells have always played a part in human history. How did they come to be associated with Christmas? Several legends attempt to explain. I'll tell you about them in a moment.
This is Greg Rowe, the Executive Director of the United Way of Linn County. For many people, an important custom of Christmas is lending a helping hand to your neighbors and friends in need with a donation to the United Way. At holiday time and year-round, the United Way and its 21 nonprofit partner agencies are helping change lives for the better. Go to our website, unitedwayoflinkcounty.org, and discover how you can help change lives. Give, advocate, volunteer. Live united.
A custom of Christmas, bells. One legend has it that 2 fine bells hung in the church tower at Loken, Holland. In those days, people baptized bells, and these bells had not been baptized. One day, Satan came by, pulled down the bells, and dumped them into 2 ponds. Villagers still believe they can hear the bells ringing at precisely midnight on Christmas Eve. Another legend says that when Christ was born, the devil died, and for an hour before midnight on Christmas Eve, a mournful bell was rung. It was for Satan's passing. Then, at exactly midnight, the joyful bells peal out. The sounds of the bells, a beautiful custom of Christmas.
The Albany Historic Interior Tours Committee presents the 33rd Annual Christmas Parlor Tour of Historic Homes, Museums, and Churches this Sunday from 2 p.m. to 7 p.m. Several historic homes will have their beautifully decorated parlors open, plus music, refreshments, horse-drawn wagon rides, and vintage trolley rides, all included in the $15 ticket price. Well-behaved children under 12 are admitted free with a paid adult. You'll see private homes and several public sites, including Albany's oldest private home, now the Monteith House Museum, lit by oil lamp and firelight, plus the Carousel Art Studio and Densel American Carousel Museum. See the decorated Victorian splendor of Albany's historic districts, both outside and in, this Sunday from 2 p.m. to 7 p.m. Tickets available from 1 p.m. on tour day at the Albany Visitor Center, 3rd and Lyons, downtown.
Clarity over agreement. Expected from Dennis Prager, weekday mornings at 9 on Smart Talk 1580.
This is KGAL Valley Talk. Glad you're with us today. Don't forget, tomorrow, Tom Cordy are going to be in the studio, and we're going to be talking about some concerns he have about some comments that the mayor of Albany made on Valley Talk about the initiative petitions that voters in Albany will be voting on this next year about limiting the city's debt limit, and some comments that I made on the show. And Hasso Herring will be in the studios as well tomorrow. We're going to be talking to Tom about his concerns, get his input on it, and that's happening tomorrow. Legacy Ballet and Pops concert is going to be in Salem, and we'll be having them as a guest as well on Valley Talk tomorrow. Don't forget to sign up for Quiznos Taste on Us. You can send Dave at kgal.com, put Quiznos Taste on Us on the subject line, or call the station at 926-KGAL or 451-KGAL. And at the end of the show today, we're going to be drawing a name out of the hat, and that person will get a $10 gift certificate good for any combination of sandwiches, drink, or chips at Quiznos in Albany, next to the former G.I. Joe Sporting Goods location and next to Novak's Restaurant. Also, don't forget, we have 2 tickets here. Oregon State versus Grambling State. It's the December 8th contest, so it's happening in 4 days. I have tickets here for section 2, row 15, seats 1 and 2. First person that emails me, Dave at kgal.com, these are your tickets. Oregon State, Grambling State, December 8th, section 2, row 15, seat 1 and 2. They're yours. Be emailer number 1 at Dave at kgal.com. And thank you for being with us on the show today. We're going to be talking about health care and possibly some of the things that are happening in the state of Oregon to change this and make it more accessible to people, and some of the things that need to be done to fix the system. In the studios with us today is Kelley Kaiser. She is the CEO of Samaritan Health Plans and Intercommunity Health Network. Kelley, thank you for being with us on Valley Talk today.
Happy to be here. Thank you.
Obamacare. Everybody's talking about Obamacare right now. As far as what's going on with Samaritan Health Plans and Intercommunity Health Network, you're telling me that the state of Oregon is actually ahead of the federal legislation. Explain that for me, if you would.
So the Affordable Care Act, which is often known as Obamacare, that went into place a couple years ago, has many phases of it. And the first phase was really a lot about insurance reform, and that did already happen and is happening currently. And one of the goals of the federal reform is to put in place accountable care organizations, which are ways to bring together those served by Medicare, which is a federal program for the elderly or disabled, and have that in a more coordinated fashion in terms of the way the care is delivered. In the state of Oregon, Governor Kitzhaber has moved forward with coordinated care organizations, which are addressing Medicaid, and moving forward with coordinating care between mental, oral, and physical health from Medicaid recipients, which is actually happening a little bit sooner than the federal legislation. So we're getting a jump start on moving forward with reform in Oregon.
Now, what exactly does this mean, coordinated care organizations? Now, Intercommunity Health Network is a CCO, or a coordinated care organization. What, if we could drill down past the nomenclature and the alphabet soup here, what exactly does that mean?
So historically, under the Oregon Health Plan, there have been different plans in place to administer different benefits. So the state of Oregon would contract with Intercommunity Health Network. Previously, we've been around for 18 years, to administer just the physical health benefit under the Oregon Health Plan. Then they would contract with a mental health plan, a mental health organization, to administer the mental health benefits to the same person. And then they would contract with a dental care organization, or a DCO, to administer the dental benefits to the same person. So you have 3 different funding streams and 3 different entities managing 3 different parts of one person. So the legislation that came out of the session last year was really to coordinate that care and bring together through one funding stream and one responsible entity, the mental, physical, and dental health of the people under the Oregon Health Plan. So that's the coordinating care. And there's some very specific things written into the legislature about what's known as the triple aim, which is bringing together cost, quality, and outcomes. And a big part of that is population health and coordinating care. And that's what we're trying to change, the way healthcare is delivered here in Oregon.
Could this also improve the quality of healthcare? If we have 3 different organizations trying to coordinate care, or not even coordinating care, but basically focusing on what they do but not talking to the others, then it would seem like there would be a lot of duplication of effort, and the overall health of the individual might suffer.
Absolutely. So if you think of maybe somebody going to the dentist and getting maybe a prescription for some pain pills, and the dentist not knowing that the primary care provider has prescribed a different set of prescriptions for the member, and that there may be an interaction. And if you don't know that, certainly at the point of payment in the computer systems, we manage all those pieces. But if we can avoid writing that script and having those interact and have better outcomes for the member, then that's a really important thing. And it's even more evident on mental health with some of the different drugs that patients could get, or different care therapies that patients could get, that we need to make sure that physical health is included, because you don't break the person apart. The person is all one person, and all of those things interact with each other.
Yes, they do. So a coordinated care organization such as Intercommunity Health Network, do you do dental care and mental health care? You'll do all of that under one umbrella?
So we have been doing the historic IHN, and we've reconstituted ourselves here this summer to have broader stakeholders and broader partnerships with the Cascades West Council of Governments, Lynn County, Benton County, and Lincoln County, public health, mental health, as well as the county commissioners. The goal would be that we have already brought together mental health and physical health. The state of Oregon, the legislation says the dental piece would be included this summer, and they're still working through some of the details. So the dental piece is not officially in the coordinated care organization yet, but mental health and physical health are.
Now, there may be people listening to this. A lot of people don't have health insurance now that maybe 5 years ago or 2 years ago had health insurance. It's becoming extremely expensive. A lot of small businesses simply cannot afford to offer that. And there's a lot of people out there that are concerned that they cannot afford health insurance. And so we're seeing kind of, just from a layman looking in, kind of a critical mass developing here, where it's getting harder and harder for people to access the system or afford to get health care. As far as the health insurance piece, making it affordable for people to at least have some kind of modicum of health insurance coverage, are we making headway in that area?
So absolutely. Back to the Affordable Care Act, or federal legislation. As we move forward with the changes that were in that legislation, a lot of those include in 2014, the federal poverty levels will be changed at the federal level, which means that many people who are currently uninsured or underinsured or don't have insurance would now qualify for Medicaid. So one step is that the federal government is changing the rules around qualifying for Medicaid and making it broader, which would bring more people in. The other piece is the health insurance exchanges, which are part of that legislation, which the state of Oregon is taking a lead on and will be going live in the next year or a little over a year. And really, those are really focused to allow small businesses or individuals to go basically online, kind of like Expedia, put in what's important to you, and then you'll get options back and you can pick and you can help decide what you can afford in terms of the type of plan, or if prescriptions are a big issue for you, but you don't really need to go to the doctor, then you can pick one that focuses on that, or if primary care is really important. And they all have to have a base benefit to them according to the law and cover all the basic preventive care services. But you as the consumer will have the ability to spend your dollars, assuming you have them, in a way that works best for you.
Is this going to make it more complicated for the consumer? You're putting more options there, and they may not be, from a knowledge standpoint, be able to comprehend exactly what they need.
It certainly could be. And I know the state, at least, of Oregon is really looking at ways to add some support in terms of some help out there, so that as consumers do this, that there's an opportunity to get help. But in the end, the goal is really that the consumer is engaged. They understand what they're getting. They understand what they're buying. They're not kind of confused by all the big insurance companies and maybe what the different plans are they're presenting to them. They can see them all very clearly laid out there and really do one-stop shopping.
Are insurance companies allowed yet to offer insurance packages across state lines? That's something that some proponents of healthcare reform would like to see, is more competition in the insurance, in the health insurance industry, and believing that competition or increased competition could drive down costs.
Many of the insurance companies here in the state of Oregon do offer in multi-states. So that is certainly something that's in place in terms of that competition already.
Trying to rewrite the book here a little bit, aren't we?
We are, certainly. And, Oregon really has been a leader in how to administer health care, with Governor Kitzhaber being an emergency room physician by training. Back in the late 80s, when he was in the legislature, he really spearheaded what we know today as the Oregon Health Plan in terms of how Medicaid is delivered. And so this is the next iteration of how we can really focus on quality and outcomes, access, and costs. And I think that's an important thing to say here, is that with these coordinated care organizations, we've been given a very specific global budget, and within that global budget includes everything that's covered. And so, and the rate of increase is mandated by the state and the Fed. So, managing the cost is a huge part of it, and the budget has been set, and you have to do all these things within that budget. So it's really a community effort to make sure we can do all this stuff, because it's not, it's pretty complicated and complex, and we have almost a smaller pie than we did 6 months ago to do it within. So the collaboration is key, and the coordination is what's going to be that ability to make it work in that small budget.
One of the things that a lot of advocates of healthcare reform are looking at is more preventative care, making and that we're getting into the argument of, that the 20-inch soda pop, may not be healthy from a healthy standpoint, a good option to do, but to look at more healthy lifestyles. Absolutely. And to look at more preventative care, because it's cheaper to deal with heart disease before it's actually occurred and on full onslaught than to go in and give somebody, heart bypass.
Absolutely. And so one of the main focuses is population health. And one of the things we're really focusing on and collaborating with all of our stakeholders within the counties and all the advocates out there is, as consumers, we all have to engage in our healthcare. And population health isn't really about a healthcare visit to a provider, a doctor, or a nurse practitioner. It's really about the food that you eat, the environment in which you live, the water you drink, the education you get. It's really that whole, everything around you and everything that you're involved in terms of living your life impacts your health and the healthcare dollars. And how do we focus back in the community, really from a public health and a community health perspective, to have a good living space, as well as having you engaged in that space as a person, as the member, as a part of the community, because in the end, that's going to reduce the healthcare costs. You're still going to have, traumatic events or certain events that you need healthcare for. There's no question about that, but the prevention is the key. And part of the legislation from the federal level related to the insurance exchanges and essential health benefits. And so they were very clear about the elements that had to be in every insurance offering on the exchange, have to have a basic amount of that prevention focus coverage in there. But if we can be just healthier in general as consumers, that is the best thing to avoid some of those heart disease or some of those chronic diseases. If you can address up front, then the impact of those long term from a quality and a cost will be less.
Let's talk about preventative care a little bit. I guess what we want to do is get people more, instead of sitting around eating potato chips and watching football on TV, go out and play touch football.
Absolutely.
But the lifestyle of America, boy, we like our easy chairs and we like our 25-inch super big gulp, and hope nobody gets offended because I use that as an example here. But we sit on the couch, we eat our chips, Twinkies, watch the game, so on and so forth. And I knew a person once who said Americans are killing themselves with their knife and their fork. We need to get off the couch and outside. Before we started the program, you mentioned that you were in Bend over the weekend skiing. And I guess my question is this: what do we do to encourage people to get off the couch, get out there like you and your family did skiing, or play touch football or whatever? What do we do to blast them off the couch?
Well, I think we have to be careful because not everybody can do as much physical things as different people, as we're all different. So it's not only doing that, but maybe take the stairs instead of the elevator. Don't drive around and try and find the closest parking spot. Maybe park a little further out, and just do some of those little things that you can do everyday choices to help you be healthier. And when you're out, maybe just don't get the fries. But you can do simple things, and everybody recognizes changing behaviors is it's hard to do. There are things we've lived with or have created and are part of our lives, so they're not going to change on a dime. So the most important thing is to just start taking those steps to think about how to change, and it will happen, and it will become second nature to you as you slowly build in those to the patterns of your everyday life.
Okay. We're talking to Kelley Kaiser. She is the CEO of Samaritan Health Plans and Intercommunity Health Network. We'll talk more about healthcare in general and maybe some of the things that are happening in the state of Oregon as we all together are trying to fix the healthcare system and increase accessibility, and hopefully in the end result we'll have healthcare and be a healthier public as a result. This is Valley Talk. I'm Dave Adams. We'll continue in just a moment.
The Osgood File. This is Charles Osgood on the CBS Radio Network. Hosting a dinner of Nobel Prize winners at the White House one evening, President John Kennedy told them he believed it was the greatest assemblage of intellect there since Thomas Jefferson dined alone. Our third president was indeed a brilliant man and an eloquent proponent of the rights of man. Yet, among the tours now given at his home in Monticello in Virginia, the guide will tell you,
"Well, I'd like to welcome you to our Slavery at Monticello tour. Monticello was a plantation. Jefferson professed to hate slavery, called it an abominable crime, but he held on to his slaves. He freed only 7.
More about that after this.
Running a facility, chances are managing inventory isn't your favorite part of the day. Stocking and tracking, ordering and organizing, all necessary evils eating up your time. That's why Grainger's Keep Stock services help you manage your inventory more efficiently, from basic labeling and scanning to secure dispensing machines, putting you in total control, often allowing you to buy less, making things seem, well, not so evil anymore. Contact your Grainger representative or visit Grainger.com/keepstock today. Grainger, for the ones who get it done.
Geico says, let's make life simpler.
You need to buy something, but you don't want to make a mistake. So what do? Scour the web? Collect sales circulars? Ask your brother-in-law? How about this? When it comes to car insurance, Geico has a 97% customer satisfaction rating. I repeat, 97%. So make it simple. Just ask a friend who has Geico. Then click or call. You could make it 98%.
Geico. 15 minutes could save you 15% or more on car insurance.
Our CBS News colleague Martha Teichner had a piece on Thomas Jefferson at Monticello on our Sunday morning television broadcast the other day.
The author of the Declaration of Independence, who wrote that all men are created equal, owned 600 slaves over his lifetime. And in addition to his legitimate children, almost certainly fathered at least 6 other children with his slave, Sally Hemings.
So it was whispered for generations. But now we know it with scientific certainty.
DNA proof of a connection came in 1998. Is Thomas Jefferson any less great because the understanding we have of him now is 3-dimensional? Pulitzer Prize-winning author John Meacham has just published a best-selling new biography of our third president.
Most human beings I know are quite capable of denial and hypocrisy. And I think that Jefferson's virtues were enormous and his vices were equally enormous. In the end, he was ultimately someone who was allowed himself to be trapped by the economic, political, and cultural circumstances into which he was born.
The Osgood File. This is Charles Osgood on the CBS Radio Network.
Quail Run Assisted Living at Mennonite Village is designed to accommodate the changing needs of its residents. Private studio and one-bedroom apartments with kitchenettes combine convenience and comfort with 24-hour availability of personal assistance and support. Private studio and one-bedroom apartments come with 3 farm-fresh meals served daily in the central dining room, housekeeping, transportation, and a variety of activities and personalized services to help each resident live a happy, rich life among friends. A wide range of social and wellness programs are offered to meet individual interests, including outdoor gardening, shopping and day trips, scenic walks, cooking and baking, art and music. Mennonite Village is where you'll find superior standards and amazing levels of devotion. The proof is in their reputation and resident satisfaction. One-bedroom and studio apartments are currently available. Call Crystal at 541-928-1122, 928-1122, or visit MennoniteVillage.org.
Weimart is just right for Christmas with big brand names and amazing low prices. Get a Magnavox 32-inch class LCD TV with built-in DVD player for only $288.88. Give a Nikon Coolpix digital camera with 16 megapixels. It's just $129.99. Stock up on Osteo Biflex and Nature's Bounty vitamins and supplements. Right now, they're 40% off the everyday low Weimart price. Hurry in. Sale prices end December 8th at Weimart. Just right for Christmas savings.
Want to really know more? Just point, click, and learn from the Mid-Valley's best website, KGAL.com.
I'm Dave Adams with Valley Talk once again, and with us in the studios, Kelley Kaiser, CEO of Samaritan Health Plans and Intercommunity Health Network. Kelley, thank you for being with us on Valley Talk today. As we tackle this complex issue of how to fix the healthcare. Everybody knows that healthcare is very expensive. Some people are having a hard time getting it. As we look at the health statistics for the United States compared to other countries in the world, we're not too healthy. Interesting thing, I lived in New Zealand. I'll just share this. I've shared it on the air multiple times. Maybe you're the one of the only people that haven't heard the story. But have you ever been overseas?
I have.
Okay. I lived in New Zealand for 9 months. And people over there are much thinner than the United States. What really jumped out at me as I got off the airplane in Los Angeles and looked at the people, I was floored because, and I've heard the statistic that America is a very obese nation. I got off the airplane in LA after being over in New Zealand for 9 months, and I was blown away. These people are huge. And it didn't really sink into me until I had that experience. Mm-hmm. And then I realized full well that the statistics, they're spot on, mm-hmm. to quote a phrase from New Zealand. But we need to not eat so many fatty foods. I guess we're back to the prevention aspect again.
And the engagement. As just a consumer, as a member of society, engaging in the process and recognizing that, of almost 50 to 60% of every healthcare dollar spent in the United States is from personal lifestyle choices of us as consumers, as opposed to a genetic or an illness or a sickness. It's really a lifestyle choice. And so we are creating this expense for ourselves. And so we as community members need to engage so that we can address that as we move forward. And that's going to be one of the ways we're able to manage the costs.
Let's talk about that. Engagement from the community is one of the ways that everybody can be involved in the mm-hmm. solution, which is important, I would think, because if you're involved in making the solution, you're more apt to help implement it than if somebody's forcing decisions down your throat. So engagement from the community, and you're telling me that a community advisory council, people from the community helping to give input into how to fix the system, that's part of the process?
So part of the legislation that came out of the state of Oregon as we move forward with the coordinated care organizations had to do with creating a community advisory council. And we in Lynn, Benton, and Lincoln counties have come together and created a 19-member community advisory council.
Who's on the council?
We have 12 actual members who are Oregon Health Plan members that we serve. We have 3 community members, one from each community. We have 1 county staff person, 1 from each county, and then another at large. So there's 19 members. 12 of them are health plan members, 3 community and 3 county employees. And really the goal of that committee is to really look at the health improvement plan of each community, of each county that we serve, recognize where the challenges are. Is it obesity? Is it congestive heart failure? What is the focus? And then how each county health departments have come together to come up with a community health improvement plan. And this council would really look at that community health improvement plan and say, okay, how does that impact the Oregon Health Plan members, and what can we do to be part of that. And, it's very different in Benton than it is in Lynn, than it is in Lincoln, with Benton being the healthiest county in the state and one of them, and Lynn and Lincoln being not at the top of the list. So making sure that we balance all those pieces as we move forward is really important to us as a health plan, as a coordinated care organization, recognizing the differences and then using those people on the ground to help us affect those differences.
So you say Benton County is one of the healthiest counties in Oregon?
Mm-hmm, it is.
Why do you think that is?
It has to do, it was a study that just came out from the state. It has to do, I think, a lot with probably Oregon State University being there and the socioeconomic impacts that those various places have in terms of the populations that are living there.
Younger people, possibly.
Mm-hmm.
Okay. Now, the Community Advisory Council, where are we as far as implementing, as far as putting people on the council to help define what a local community or a local county is in developing a plan going forward?
So the county health departments have actually done a great job of this over the last 3 to 4 months. And what we've done is created a local community advisory council, one in Lynn, one in Benton, and one in Lincoln. And out of that, recommended people to be on the regional one. We've had 2 meetings of the regional council, so it's in place, that has the representatives I mentioned earlier, 19 people on the council. We're scheduling our 3rd meeting in the next week or so, and we're really just working through our charter right now. It's a pretty diverse group with a lot of great input, and so getting to know each other as a council. And the goal would be that they would go back to their local council, which is unlimited and has much public input, and understand what's going on in their communities, and bring that back to the regional council. Look at those opportunities in ways that they can impact the care that's being delivered. And then one member of that Community Advisory Council will be a voting board member on the Inter-Community Health Network Coordinated Care Organization's governing board. So they will have direct connection to the governing board to make sure that what's being decided here really is impactful and is what needs to happen from the members' perspective. So closing that loop.
What kind of authority will they have? Will they be able to define Oregon State health coverage going forward and saying, this just isn't working on the local level, we have too many MRIs here and not enough preventative care, that kind of thing?
It's really more about the benefits really defined by the state in terms of what's covered and what's not. It's really about how the care is delivered, how it is coordinated, and what's important at the community level. So, how do we address access for children with mental health needs in Lincoln County? That's been identified as an area that we could do better as a community. Okay, so what does that mean, and what can we all do to work together to improve access to mental health care in Lincoln County? So it's more of the access and the delivery of the care as opposed to defining what's covered.
One of the things that's been driving up healthcare costs is emergency room visits. People, because they can't get access to healthcare, wait and they get very, very sick, and then it becomes an emergency, or they simply don't know where else to go, and so they just show up at the ER. And so ERs are, as you probably well know, overloaded, overburdened. Cost of care in an ER is extremely expensive because the people that you have staffing ERs are very expensive people. They're well-trained, trauma care, and I've got a sore throat, and I go in there just because I've had a sore throat for 3 weeks, and they're, tell me to drink plenty of water and go home, and I get a $500 bill for that. What do we need to do to keep those ER visits down?
Well, that prevention focus is a huge part of the legislation as well in Oregon, and in general in health reform, and what you'll see providers doing around the state and the country with the focus on the patient-centered primary care medical home. And the goal is that everybody does have a medical home to go to, so that there is enough access for you to get in. And within that home, there's a whole group of people that are going to help you manage your care. There probably most likely will be a physician as sort of the champion of that. Mid-level, maybe a nurse practitioner, physician's assistant. There could be a behavioralist to help you think through some of those things that are more from a behavioral perspective. If you have diabetes, maybe there's a nutritionist there, or a pharmacist there. So really, it's kind of geared to be that one-stop shopping to address all the needs of the whole patient and not just one part of them, in more of a team approach where you'll have more time to spend with certain people, and you'll have each provider or each member of the team working at the height of their license. So the physician maybe won't see you for a sore throat. We would have the nurse practitioner or the nurse or the physician's assistant see you for that. But the physician would be there and be understanding all your care in case something gets worse and you end up with pneumonia or whatever those pieces are. But so everybody practicing at the height of their license allows more access for the patient because there's more of a team there to take care of you, but it's also more efficient with the time and the dollars in terms of how that's delivered.
You mentioned the phrase a medical home. So are we talking, what does that mean?
So a medical home, a patient-centered medical home is really, again, this team that is about me as the patient. An example would be in a patient-centered medical home, which we have some here in the Valley, that they would look at their patient list for the day, and they would look at all the patients they have coming in. They would have a case conference in the morning before the patients come in. And they're, this team, whether it's 6 people or 3 people, includes a physician and a mid-level, a behaviorist, a pharmacist, whatever the team is made up of, would sit down and say, okay, Kelley's coming in today. Where is she? What's going on with her? Well, she's been having anxiety attacks, so I think the behaviorist, you need to see her for a little while. That's impacting her her stomach and how she's feeling, so we'll need to make sure we check on that from a more physical health perspective. We really think part of this has to do with her diet and her environment that she's living in, so we want her to talk to the nutritionist, and they have this planned for me before I get there. And so when I get there, I'm part of this team, and they're addressing all of my needs and helping me work through whatever my challenges are. And then they all know what's going on. So maybe next time if I do show up at the health department, maybe they'll know that my primary care medical home is this group, and they'll send me back to it so that I have that coordination, and I keep going back to the place where they know me best and can help me best.
Who pays for the primary? We call it a medical home here, for lack of a better term. So it's just kind of a central location where you go to get your primary care. Mm-hmm. Is it like a doc in the box?
It could be. It usually is led by a physician, and with a broader team around them, and it's currently paid for now, and would continue. The goal of the health reform is to enhance the services available there and come up with better and more creative ways to pay for it, as opposed to your traditional fee-for-service model where you get paid for every a doctor gets paid for every patient they see. Maybe it's, you have a panel of patients, and your job is to make sure their quality outcomes and the quality they get and the outcomes they receive are at a certain level, and you'll get paid a flat amount for that. So whatever you as the patient-centered medical home think is the best thing, maybe it's not seeing the doctor every time, maybe it is that behavioralist that puts that decision-making back into the provider's decision tree, but isn't about a fee-for-service basis. It's really more of a panel approach where you keep them healthy and you make sure you meet these requirements, then you'll get these dollars.
Kelley Kaiser with Samaritan Health Services with us on Valley Talk, and we'll continue with the program and the comments in just a moment.
Let it snow. The Shed Institute and the Emerald City Jazz Kings will warm you up with their annual Christmas show in Corvallis, Thursday, December 13th. Usher in the joy of the holiday season with Christmas favorites like Sleigh Ride, I'll Be Home for Christmas, Jingle Bells, Santa Claus is Coming to Town, Warm December, Chestnuts Roasting, and many more. As always, the Jazz Kings performance will be unforgettable. The Jazz Kings is a big band of fine Northwest musicians, plus an excellent group of singers. One performance only in Corvallis, Thursday, December 13th, 7:30 p.m. For more information, go to KGAL.com or KShow.net and click on the OFAM link, or call 541-434-7000. Tickets will also be available at the door. The Emerald City Jazz Kings at LaSalle Stewart Center on the OSU campus. Tis the season and time for planning holiday parties and memorable company celebrations. Be sure to include Mama's Fine Italian in your plans. Have the party at Mama's in Lebanon or book them to cater your event. Either way, it will be superb, and your guests will love it. Need a special bottle of wine for dinner tonight or for a party hostess gift? No better place or price than Mama's incomparable wine shop. Closed Sunday and Monday, so make the most of the other 5 days and join your friends at Mama's. Like them on Facebook or contact them through their website, mamasfineitalian.com. Call for reservations or to plan your holiday party. 541-451-5050. That's 451-5050. Mama's Fine Italian and Wine Shop on West Oak between Main and 2nd in Lebanon, across from the Big Blue Napa Auto Parts building.
This is Mike Parker, the voice of OSU Sports. Whether I'm in town or away, I know my family is in good hands with Security Alarm Corporation. Our system from Security Alarm Corporation gives me the peace of mind to focus on my work, while their alarm dispatchers are on the job 24/7. I trust my friends at Security Alarm Corporation, and you can too. Security Alarm Corporation, proudly serving fellow Oregonians for 39 years.
We were coming home from a long weekend. I couldn't believe what I saw. Fire trucks were in front of our house. The fire chief said it was an electrical fire, but everything was okay because of the early warning. Our first alert professional security system detected the fire and called the central station. They sent help immediately. I'm so glad we had that security system protecting our home.
You too can have an affordable system from Security Alarm Corporation, your local security professionals since 1973.
Valley Talk, weekday mornings on News Talk 1580 KGAL.
Our conversation with Kelley Kaiser continues. The medical home, getting back to that again, are these in place yet?
We have, actually, there's a number of them within Lynn, Benton, and Lincoln counties.
What are they called?
They could be one of your physicians you already have.
Okay.
Samaritan has a number of them within their offices within Lynn, Benton, and Lincoln counties. The federally qualified health centers for Lynn, Benton, and Lincoln counties have them. The Corvallis Clinic has primary care medical home models within their groups. The independent physicians all have primary care medical models in various levels throughout their groups. So they're more of a new thing that are getting ramped up, and they're all kind of in different levels, but they all meet a basic minimum requirement, and that you'll see that coming very quickly in terms of the skill set and the opportunities available to a patient as they walk into a medical home as they continue to grow.
So let's say there's an older gentleman or an older lady that's listening to the program right now, and they're liking what we're saying, and they're having to decide between getting blood pressure medication or eating. Would the medical home be something they could call up and say, hey, here's my situation. I'm on a fixed income. My husband died. I'm on blood pressure medication. I can't afford to pay the medication, and so on and so forth. Is that something that you could help out with?
I think what could happen would be they could certainly call their provider's office, and one thing that we've learned is that sometimes some people are on 10 to 20 medications and they don't really need them all. So another service that a patient-centered medical home can offer is a pharmacist consult, where you could come in with all of your medications and they could sit down and look at your chart and understand everything happening and say, you know what, you only need 10 of these. These three were, because they didn't know these three were being given, and that could really save you some dollars alone right there with just doing a medication therapy management session where you understand, and maybe they're all needed, but at least you would know at that point. In terms of covering food versus medicine, that's a bit more of something that's probably could certainly get some resources. The medical home could get you some resources in the community to get Meals on Wheels or to do some other options, but they wouldn't be able to decide between the two. That would certainly be up to the patient.
Okay. How much one of the things that keeps coming up is coordinated care, duplication of effort. You go to one doctor in one town and he doesn't know the history, and he might be prescribing something that might be adversely effective to the patient or just simply not efficient. I don't know if you have the answer to the question. I'm going to ask it anyway. Has there been any study that's done to say, okay, this is a huge issue, but if we coordinate care, we could save X number of dollars?
Well, really, that's part of the assumptions that the Oregon legislature has made in the last session that created the coordinated care organizations. And one of the underlying pieces of that is a health information exchange and the technology that is in place and can be grown even more to allow that communication. So as a patient gets online and is able to see their own personal health record, and physicians and provider groups are able to go online through electronic medical records and connect from other sites, you'll see if I am a patient at the Benton County Health Department or the Lynn County Health Department, and I'm a patient at Samaritan, and we get those to where they're appropriately and through HIPAA and all that good stuff communicating, then I might show up at the health department to get an immunization, and my record will come up and they'll say, oh, but we look like we already you already got this last week. And so that wouldn't be a duplication there. So technology is a big foundation for helping that information exchange happen and hopefully to manage that duplicative services so that there's less waste.
Kelley Kaiser, she's with Samaritan Health Services, the CEO. Thank you for being with us on Valley Talk today. Tomorrow, Tom Cordier, as we talk about the initiative petitions that Albany voters will be voting on this next year. That and more on Valley Talk tomorrow. Listen for our promos. I'm Dave Adams. Make it a good day.
Serving the Mid-Valley for over 50 years. You're listening to News Talk 1580 KGAL, Lebanon, Albany, Corvallis.